Hello and hi. Today we will talk about sympathetic skin response test in EMG. Sympathetic skin response is potential generated by sweat glands respond to a variety of stimulation. This technique records change in skin conductance after activation of sweat glands in areas of the skin that are rich in anchoring glands under the neural control of sympathetic cholinergic fibers. The amplitudes and configuration are adjusted by sweat gland epithelium and the overlying epidermis. These are the several of diseases that are suitable for the test. First, skin tightness. The skin tightness is caused when the number of dead skin cells is increased, leaving a layer on a skin surface that can cause it to dry out and feel tight. Roughness is also caused by dryness. Second, Reynolds phenomenon. Reynolds is usually triggered by cold temperatures, anxiety, or stress. The condition occurs because your blood vessels go into a temporary spasm, which blocks the flow of blood. This causes the affected area to change color to white, then blue, and then red as the blood flow returns. Pitting scars. The pitting scars are a name given. Egg scars are characterized to a hollow, indent impression in the skin. This concave appearance is due to a sudden loss of collagen. Pit end scars encompass three main types of egg scar: ice pick scars, box scars, and rolling scars. And lastly, of the mouth opening. The normal range of mouth openings differs from person to person, varying between 40 to 60 mm and averaging between 35 to 55 mm, which is equal to the width of 3 fingers. It has been shown that gender may be a factor in mouth opening. In general, males display greater mouth opening. Trismus is an uncontrolled inability to open the mouth or jaw. Trismus interferes with many daily activities like chewing, swallowing, talking, brushing teeth, even breathing. The condition may be caused by dental problems, cancer and cancer treatment, surgery, trauma, and other factors.
Electrode attachment on subject. The electrode placement in SSR can be used in sympathetic skin such as hand or foot. Figure above show the placement of electrode on the subject hand. The following tell the procedure of electrode placement on the hand. The firstly, place the active electrode, black, on the thumb center. Secondly, place the reference electrode, red, at the dorsum of the hand. Next, the ground on the side of wrist. And lastly, place the simulator on 1 median nerve location as shown above.
Procedure of the test. During the test, the subject sat in a comfortable armchair and was relaxed but not asleep. The room temperature was maintained at 24 plus minus 0.5 degrees Celsius. Skin temperature of the examined limbs remained unchanged, 33 plus minus 0.5 degrees Celsius, all over the time of the test. This protocol was followed because the temperature is known to affect conduction velocity of unmyelinated sympathetic fibers. The SSR technique and recordings were based on the procedures described by Shahani and his colleagues. An investigator performed all the steps of the experiments, and care was taken to avoid all external stimulation. Step 1. In module, select window. Choose others, RNS. Choose the testing site between right, left, and none. Then click next. Step 2. Make sure EMG hardware is on and connected to the PC. Connect the EMG electrodes and stimulation electrode to the amplifier and place them onto the subject's target nerve with electrode pads. Step 3. Click impedance to check impedance value of electrode connections. Choose the two active EMG channels from top right of the interface and then click impedance to check impedance value of electrode connections. If connected properly, all impedance values should be below 15k ohms. Step 4. Click on a box at left of waveform display area. Make sure number of active channels, see top right, and number of boxes selected, dark blue boxes, are the same. Right-click on the boxes to input stimulation position and recording position. Step 5. Set current stimulation intensity at 20 to 30 mA, depending on the subject's skin thickness. Step 6. Ask the subject to relax before the test. Place the stimulation electrode onto the nerve and click single without informing the subject to stimulate the nerve. Repeat with varying stimulation value until maximum amplitude output is achieved. Note, if the output waveform is too noisy or not shown in a one-pulse pattern, check connection as one of the electrode may not be connected properly. And lastly, the data output for this test is the following. Latent period 1, onset latency value of the measured waveform, unit S. Latent period 2, complete latency value of the measured waveform, unit S. PP value, amplitude of measured waveform for measured waveform, unit S. Area value of waveform, unit MS star MV.
This protocol was followed because the temperature is known to affect conduction velocity or unalienated sympathetic fibers. The SSR technique and recordings were based on the procedure described by Shahani and his colleagues. An investigator performed all of the experiments and care was taken to avoid all external stimulation. Sympathetic skin response is a low-cost, non-invasive method with a low possibility of complication and might be a helpful diagnostic test for men with chronic prostatitis type IIB. However, this observation needs to be validated in a large sample cohort study with long-term follow-up.
As the conclusion, sympathetic skin response is a low-cost, a non-invasive method with a low possibility of complication and might be a helpful diagnostic test for men with chronic prostatitis type. However, this observation needs to be validated in a large sample cohort study with long-term follow-up.